Hi, I'm Dr. Hannah. I'm a clinical psychologist, and today I want to talk about unhelpful things you might hear if you've been diagnosed with medically unexplained symptoms. If you are someone living with persistent physical symptoms that don't have a medical explanation, you might have been on the receiving end of some really unhelpful comments or reactions. These might have been from the people around you, friends or family, but they may also have come from health professionals. Many medical services struggle to address the unique challenges of persistent physical symptoms, often failing to take a holistic biopsychosocial approach. As a result, many individuals feel unsupported, disbelieved, and isolated while navigating these symptoms, making it even harder for them to find solutions. In this video, I'll explore some of the common, often well-meaning, but extremely unhelpful things people might say when they lack an understanding of these symptoms and the impact they have. I'll also share key insights that debunk myths around medically unexplained symptoms and guide you towards the support you truly need. What are some of the unhelpful things you might have heard if you are someone who's living with these symptoms? It's all in your head. This phrase suggests that your symptoms are imaginary or purely psychological. While psychological factors can contribute to physical symptoms, this statement minimizes the complexity of the issue and can make you feel invalidated or stigmatized. The thing to remember is your symptoms are real physical symptoms and they are not in your head. There's nothing physically wrong with you. As a psychologist working with people living with these symptoms, we always want to start by ruling out serious medical conditions. However, when people say there's nothing physically wrong, without offering any further options, this can feel very dismissive for the person experiencing these symptoms. It can make you feel as though your experience is not real or worthy of attention. This is one of those common, well-meaning, but very unhelpful phrases, and it fails to address the most important thing: there is something wrong. And it's important to explore what can be done about it. It's just psychological, or it's just anxiety. The just is doing a lot of heavy lifting here. People will often say things like this to offer reassurance or even to offer hope. But with that just, they also send a message that dismisses the complexity of the symptoms and the disruption they are causing to a person's life. There's no such thing as just anxiety. Anxiety is a complex problem to solve, and we aren't equipped with solutions for it until we learn them. There's no point in running more tests, or I don't know what's wrong, but there's nothing more we can do. When a doctor runs all positive tests and finds no clear cause for symptoms, they might consider this a positive outcome, having ruled out serious illnesses. However, for the person experiencing the symptoms, the issue remains unresolved. They're left not only with the physical discomfort of the symptoms, but also with the overwhelming uncertainty of not knowing the cause. And this uncertainty adds a layer of stress and anxiety as they continue to cope with both the symptoms and the worry of not having found an explanation. It's probably just stress. Have you tried mindfulness? And when you're dealing with debilitating, unexplained physical symptoms, hearing someone suggest mindfulness or other self-care strategies can feel deeply dismissive. Now, while the intention behind such advice is often well-meaning, mindfulness-based interventions do show promise for addressing stress, anxiety, and medically unexplained symptoms, it misses a crucial point. For someone experiencing these symptoms, reducing them to just stress fails to acknowledge the profound impact they have on their life. They're not just managing physical discomfort, they're grappling with fears about the cause and the uncertainty of their prognosis. What does it mean for their future if the cause remains unknown? Responses like these are not intended to harm, but they often stem from a fundamental misunderstanding of the experience of medically unexplained symptoms. Our medical system is designed to address physical ailments with clear causes. And unfortunately, many health services are not equipped to help people navigate the complex challenge of understanding and treating symptoms that defy explanation. As psychologists, we recognize that medically unexplained symptoms are multifaceted, and they require a specialist, holistic approach. When we work with individuals facing these symptoms, our goal isn't to rule things out or tell them what isn't wrong, but to provide a meaningful explanation for what is happening. Something the medical system often struggles to offer. If you're living with persistent physical symptoms, it's likely that you've heard some of these well-meaning but unhelpful comments when discussing your experiences. And it is completely understandable if this has made you feel hesitant to seek further support. For those with medically unexplained symptoms, the path to getting the help you need can often feel unclear and frustrating. So with this video, I want to debunk a common myth, that it's the end of the road if no medical cause can be found for your symptoms. We are continually learning more about these conditions and the groundbreaking treatments now available. While these treatments may not work in the same way as a pill or surgery, they share the same goal: to help you find your way back to a life well lived, whatever that means for you. Psychological treatments don't aim to treat symptoms as purely psychological, but they do encourage exploration of the psychological aspects of a person's experience. This approach is not limited to medically unexplained symptoms. Any physical health condition is influenced by an individual's psychological response to it. For example, two people with diabetes may have entirely different experiences of the condition, depending on their willingness to accept it and learn how to manage it, adhere to treatment, and adjust their lifestyle accordingly. When someone is struggling with physical symptoms, it's often helpful to explore the psychological factors that might shape their experience. For individuals living with medically unexplained symptoms, seeking psychological treatment may feel like an admission that their symptoms are exaggerated or imaginary. It is crucial to challenge this misconception. Psychological factors are just one piece of the puzzle. Exploring these factors with a skilled professional can be transformative for those living with these symptoms, offering valuable insights and support that can significantly improve their quality of life. Misconceptions and stigma often result in unhelpful responses for those living with medically unexplained symptoms. However, with the right support from healthcare professionals who possess the knowledge and expertise to understand these symptoms, it is possible to find effective ways to manage and overcome them, even in the absence of a clear medical explanation. Hi, I'm Dr. Hannah Sugarman. I'm an HCPC-registered clinical psychologist. You can find me on Instagram at Dr. Hannah Sugarman, or on my website at drhannahsugarman.com. I've just finished shooting some videos with Mindfriend. Watch this space for more.